Hey everyone, it's Whats ZEE here, your friendly guide to understanding health. Today we're diving deep into a topic that can seem complex, but is crucial to understanding leukemia. In the simplest terms, leukemia is a type of blood cancer that affects your bone marrow, the spongy tissue inside your bones, where blood cells are made. Now, our bone marrow is a bit like a busy factory, producing all the different types of blood cells our body needs, including white blood cells that fight infection. Leukemia disrupts this process. It leads to the overproduction of abnormal white blood cells. These abnormal cells, unlike their healthy counterparts, don't mature properly and can't fight infections effectively. What's more, as these abnormal cells multiply rapidly, they crowd out the production of other essential blood cells, like red blood cells and platelets, leading to various health complications. Stay tuned as we explore the symptoms, causes, and types of leukemia in the following sections. Leukemia can be a bit tricky to spot initially, as its symptoms often mimic those of other common illnesses. However, being aware of these signs is crucial for early detection and treatment. So, what should you be on the lookout for? Frequent infections top the list. Remember those abnormal white blood cells we talked about? Because they can't fight infections effectively, people with leukemia are more susceptible to infections and may get sick more often. Another telltale sign is persistent fatigue and weakness. This exhaustion stems from a shortage of red blood cells responsible for carrying oxygen throughout the body. You might also notice unusual bleeding or bruising. This happens because leukemia disrupts the production of platelets, the tiny blood cells that help with clotting. Other symptoms can include unexplained weight loss, bone or joint pain, and swollen lymph nodes. It's important to remember that experiencing these symptoms doesn't necessarily mean you have leukemia. However, it's crucial to consult a doctor for a proper diagnosis if you notice any of these signs, especially if they persist or worsen. Stay tuned as we explore the causes and different types of leukemia in the upcoming sections. The exact causes of leukemia are still not fully understood, making it a complex disease to pinpoint. However, research has identified several risk factors that can increase your chances of developing this blood cancer. One significant risk factor is exposure to high levels of radiation. This can include radiation therapy used to treat other cancers, or exposure to very high doses of radiation from sources like a nuclear reactor accident. Certain chemical exposures also increase the risk of leukemia. Prolonged exposure to benzene, a chemical found in gasoline and used in various industrial processes, has been linked to an increased likelihood of developing leukemia. Furthermore, a family history of leukemia can also increase your risk. If you have a close relative, such as a parent or sibling, who has had leukemia, your chances of developing the disease may be higher. While these are some of the known risk factors, it's essential to understand that leukemia can affect anyone, regardless of their risk profile. Further research is ongoing to unravel the complexities of this disease and develop more effective treatments. Stay tuned as we delve into the different types of leukemia and discuss diagnosis and treatment options in the following sections. Types of leukemia. Leukemia is not a one-size-fits-all disease. It comes in different forms, each with its own characteristics and prognosis. One way to classify leukemia is based on the type of white blood cell affected. Lymphocytic leukemia affects lymphoid cells, which develop into lymphocytes, a type of white blood cell crucial for immune response. Myelogenous leukemia, on the other hand, affects myeloid cells, which give rise to various blood cells, including red blood cells, platelets, and some types of white blood cells. Leukemia is further categorized based on its rate of progression. Acute leukemia is a fast-growing cancer that requires immediate treatment. Chronic leukemia, in contrast, progresses slowly, and symptoms may not appear for years. Understanding the different types of leukemia is crucial for determining the appropriate treatment approach. Your doctor will conduct a series of tests to determine the specific type of leukemia you have and tailor a treatment plan accordingly. In the next section, we'll delve deeper into the diagnosis and treatment options available for leukemia. Diagnosis and treatment of leukemia. Diagnosing leukemia starts with a physical exam and medical history review. A blood test checks for abnormalities in blood cell counts. A bone marrow biopsy may follow to examine for leukemia cells. Treatment varies by type and stage, including chemotherapy, radiation, and stem cell transplantation. Have questions? Drop them in the comments below.